is a horseshoe-shaped structure located in the parietal lobe, directly superior to the temporal lobe. It is also in Brodmann area 39 of the human brain, located between Wernicke's area and the visual cortices. The angular gyrus is involved in language comprehension and plays a role in complex language functions such as reading, writing, understanding written language, and reasoning. Thus, it establishes the connection between the understanding of written language, visual symbols, mathematical ability like number processing, and spatial recognition and the retrieval of memory. This area was described by Geschwind, a neurosurgeon, as the most important cortical areas for speech and language. A damage or lesion in the angular gyrus can result in a variety of symptoms. It has been defined as consisting of the following neuropsychological deficits: transcortical sensory aphasia, which is the loss of ability to understand or express speech caused by brain damage; alexia, which is the inability to read; agraphia, the inability to copy written work; and components of Gerstmann syndrome. Gerstmann syndrome includes acalculia, which is the inability to use arithmetic operations; it also includes agraphia and laterality confusion, which is difficulty in distinguishing the left from the right; and finger agnosia, the inability to name, move, or touch specific fingers. Damage to the angular gyrus can also include impaired visuoconstruction ability, which involves the coordination of fine motor skills with spatial abilities, typically to make a design. Damage to the inferior parietal lobe of the dominant hemisphere, which includes the angular gyrus, the supramarginal gyrus, or the white matter underlying these structures, produces the angular gyrus syndrome. Because the left hemisphere is dominant for language in most individuals, the syndrome most commonly results from left parietal injury. The deficits that comprise the angular gyrus syndrome are observed on both sides of the body because angular gyrus is functionally connected to both cerebral hemispheres. For example, finger agnosia is observed in both hands. Damage to the angular gyrus can also result in behavioral manifestations such as depression, poor memory, frustration, and belligerence. The symptom profile can resemble a number of other disorders. It has been mistaken, for instance, for dementia. Because patients with angular gyrus syndrome meet the criteria for dementia, verbal recall deficit, and one or more additional cognitive disturbances, they are often misdiagnosed as suffering from Alzheimer's disease. In a study of 14 patients with features of angular gyrus syndrome, experienced clinicians misdiagnosed 7 patients with Alzheimer's disease. The most common cause of angular gyrus syndrome is cerebrovascular disease, especially the occlusion of the angular branch of the middle cerebral artery. Other lesions that have been reported to cause angular gyrus syndrome include neurodegenerative diseases such as Alzheimer's, developmental anomalies in children, infections including human immunodeficiency virus, a subdural hematoma, arteriovenous malformations, and inflammatory diseases such as lupus and granulomatous angiitis of the CNS, brain tumors, trauma, abscesses, and gunshot wounds.